And we're going to do a practice here. Let me just quick definition of trauma-sensitive practice. This comes from National Center for Trauma-Informed Care. This is a 4R definition. If you were to call yourself trauma-sensitive in your professional work, the proposal here is that you're doing 4 things at the same time. One is that you've done some work to realize the widespread impact of trauma. The fact that you're here, you probably check that box. You've done some reflection in an ongoing way about who experiences trauma and the fact that it's often present in the rooms that we're in. Second is that you can recognize symptoms of trauma. This is a harder one inside of meditation because often people, they're not necessarily talking to you. They might have their eyes closed, but there's actually some nonverbal signs and symptoms that you can look for that someone might be experiencing what's known as dysregulated arousal. We'll talk about that in a moment, but might be experiencing signs of post-traumatic stress. The third is, do you know how to respond? If someone came to you individually or in a group and said, I'm struggling with flashbacks, I'm having trouble here, this is not working for me, would you know how to respond? Again, this is Jessie and her work around traumatic brain injury is to say, I'm going to create a whole set of best practices to help people actually know what they could do in order to respond effectively. The final one is avoiding re-traumatization. This is the kind of a core precept is we're saying, at least let me do no harm. At least let me try to make things not worse for people. So that's an ongoing thing that we're looking for in the background, something we take on. Okay, we're going to do a practice here. I'll talk about best practices in a moment, but let's do a practice together. I want you to have a chance to feel what I mean around trauma sensitivity as opposed to just the conceptual aspect of it. Some of you might have done this with me, but if you haven't, well, if you have, you get to do it again. Here's what we're going to do. This is going to involve working with your hands. If you do not have access to your hands, you can use your feet. You can also visualize this practice. This is going to be a practice of what does trauma sensitivity feel like in the body? Okay. I'd like you as an experiment to imagine that the job of one of your hands is to stay closed. I want you to make a clenched fist with one of your hands. And I want you to imagine that the job of this fist in staying closed is to take care of your safety and your survival. I'm going to have my hands up here. You do not need to have them in the screen. You can have them in your lap. So closed fist, taking care of your safety and your survival. Then as an experiment with the other hand, try to open the fist. Give yourself a moment here. Really experiment with that. What happens to the fist? What happens to your breath? What narratives come up? Okay, great. You can let that go. Shake it out if you want. Okay, second part here. Same thing, making a closed fist. Job of the fist is to stay closed, taking care of your safety, survival. Into the other hand, bring a quality of care, compassion, and respect. Okay, care, compassion, and respect into the open hand. And when you're ready, you place that hand underneath the fist. And when you do that, see if you can communicate something like, good job. Good job. Of course you're closed. You're taking care of safety. Good job. And as you did the first round, just noticing what happens to the breath, what happens to the fist. There's a quality here of no agenda. It's like I'm just here, I'm listening, and I'm respectful. Noticing if there's any also narratives that come up. Okay, and then when you're ready, you can let that go. And just noticing before we shift if there was a difference for you between the two. If not, no problem. And if there was, what was it, and what learning is there in for you, in there for you? What relevance might that have for you in your personal or professional life?